Fortunately, the past 30 years has brought to the task force core capabilities that are needed for us to take the next step forward. Because of our history at bringing people together, acting as a convener, acting as a group that helps crystallize an understanding of a problem and coalesce action. That's really the right formula for tackling and making progress.
I think leadership begins with caring. We've had that kind of leadership at the task force. People who really care about health equity, who care about disadvantaged communities and countries, care about children and the health of children. They know what it takes to solve problems.
Our work is driven by our values, the value of global health equity, that people everywhere, even the poorest people in the poorest countries, should have the equal access to the means of good health.
Well, the task force began with concerns about immunization rates and using the technology available to prevent vaccine-preventable diseases, largely in Africa. But that extended to the use of life-saving drugs and the drug donation programs with Mectizan and others to prevent and eradicate diseases which can be eliminated from the world.
The task force, we're approving over $1 billion worth of drugs every year, donated. And actually mass drug administration is now seen as a sort of standard tool for hitting the diseases that affect what we often call the bottom billion. Mostly the poorest populations, mostly the populations with no political voice, no economic voice. These are the people who need the drugs most, and we have over a period of time developed systems of getting drugs for mass drug administration to those very remote communities.
Trachoma is a bacterial disease of the eye, and it has a devastating effect on an individual's family, and on communities. Repeated infections lead to severe trachoma, an incredibly painful and awful way to lose your sight. This sort of project really shows the unique role of the Task Force for Global Health in being a neutral convener, but yet the catalyst that can bring together partners and the very people themselves, bringing them all together in order to achieve something that looks like a miracle, but is actually the result of hard work.
A new Bill and Melinda Gates Foundation funded initiative called CHAMPS, which is the Child Health and Mortality Prevention Surveillance Network. This initiative is aimed at going to those places in greatest need, with the highest infant mortality, and changing it. But it's probably one of the most significant global health initiatives in our lifetime. This is very, very important to actually determine why kids are dying, and then using that information to come up with interventions that changes it. And then once changed, to do it in a way that that change remains.
The results of this entire effort are so mind-boggling that even though I've been watching global health for 65 years, I continue to get enthusiastic just seeing what's happening. It used to be that we lost 50,000 children under the age of 5 every day in the world. I mean, imagine that. We're down to about 16,000, a third in my lifetime. That's still far too many. It's obscene to have to lose that number of children. But when you see the improvement, it takes defining your last mile before you do anything else. Because gradually the things you thought could not be done are being done. I grew up with the phrase, seeing is believing, only to find that was backwards. Believing is seeing. If you believe in something, you are going to be able to see it. Because now you have a vision of what does that last mile look like.